picture this. You're about to step into one of the biggest moments of your week. Maybe it's a big match, maybe a difficult conversation, maybe it's a pitch, an exam, a presentation, a podcast recording, or a moment where you know you need to be at your best. And just when you need your mind to be clear, your nervous system decides to hold its own cup final. Your heart rate climbs, your breathing changes, your thoughts start bouncing around like marbles on concrete. Part of you is ready, another part of you is scanning for danger. So here is the question. What if there was a compound in tea that could help some people move closer to that sweet spot between calm and sharp? Not sedated, not wired, not numb, just a little more settled, a little more focused, a little more able to access what they have already trained. That compound is called L-Theanine or L-Theanine. You'll find it in green tea, black tea, matcha, and increasingly in capsules sold for anxiety, focus, and sleep. But today we're not doing a supplement hype. We're asking a better winning edge question. Does L-Theanine genuinely help people perform under pressure, or is it just another wellness trend with a clever packaging? And even if it does help a little, how should a coach, athlete, leader, or high performer think about it responsibly? Because the real edge is not outsourcing your calm to a capsule. The real edge is learning how your nervous system works, building routines that support it, and using tools intelligently when they fit the bigger system. Before we begin, a quick important note. This episode is for educational and informational purposes only. It is not medical advice and it is not a recommendation to take any supplement. If you're considering L-Theanine or L-Theanine or any other supplement, especially if you take medication, have a medical condition, are pregnant, breastfeeding, or have concerns about anxiety, sleep, or blood pressure, please speak to your doctor, GP, pharmacist, or a qualified medical practitioner first. Welcome back to the Winning Edge Coach podcast. I'm your host, Kev Oakley, and this is where we break down the tools, tactics, and strategies that build a stronger, more resilient mindset so you can perform at your best when it matters most. In today's episode, we're talking about L-Theanine or L-Theanine, depending how you pronounce it, a naturally occurring amino acid found mainly in tea leaves. If you drink tea or matcha, you're already consuming small amounts of it. If you have walked through the supplement aisle recently, you'll probably seen it sold in capsules or powders promising calm, focus, better sleep, or stress relief. And that is where we need to slow down. Because in the health and performance world, supplements are often marketed as shortcuts. Take this, feel calm. Take this and sleep better. Take this and unlock focus. But in this episode, I want to look at it through a different lens. We're not just asking, does L-Theanine do anything? We're asking, can it help the right person in the right context for the right reason? Is the effect meaningful enough to matter in real life? What are the limits of the evidence? How do we use it without ignoring the foundations? And when does using a supplement become a way of avoiding the deeper work? And that last question matters. If someone is anxious before competition, the answer is not automatically take something. It might be better preparation, it might be exposure work, it might be breath work, it might be caffeine management, it might be sleep, it might be reframing what adrenaline means. If someone cannot focus, the answer is not automatically take something. It might be phone addiction, poor task design, lack of recovery, chronic stress, or trying to do too many things at once. Someone cannot sleep. The answer isn't automatically take something. It might be light exposure, late caffeine, irregular routines, overtraining, rumination, or genuine clinical insomnia that needs proper assessment and proper medical treatment. So our frame today is simple. L-Theanine is not magic, but it is not automatically snake oil either. It might be a small tool. Small tools only work when they're placed inside a bigger performance system. Let's start with the basics. L-Theanine is an amino acid found primarily in tea. It's one of the reasons tea can feel different from coffee. Coffee often feels like stimulation. Tea, for many people, feels a little smoother. That's partly because tea naturally contains caffeine and L-Theanine. Now, the amount you get from tea is usually much smaller than the amount you get from a supplement. A cup of green tea may contain a small amount of L-Theanine depending on the type of tea and how it's brewed. A supplement capsule is often much higher, commonly around 100 to 200 milligrams. So when someone says it is natural because it is in tea, that's only half the story. Yes, it is found in tea, but a capsule may deliver a much larger dose than you would normally get from drinking a cup of tea. That does not automatically make it dangerous, but it does mean we should treat it with respect rather than casualness. The main claims around L-Theanine are usually three things. It may reduce stress and anxiety. It may support calm focus, especially with caffeine. It may help sleep quality, particularly when a busy mind is part of the problem. Those claims are interesting because they all connect to performance. Anxiety affects performance. Focus affects performance. Sleep affects performance. But there is a big difference between may support and will fix. That difference is where good coaching lives. Because if you're a coach, a performer, a leader, a parent, or a student, or someone trying to improve your life, you do not need exaggerated promises. You need clear thinking. So let's look at what L-Theanine appears to do in the brain without getting lost in the jargon. When you take L-Theanine, it can enter the bloodstream and appears to be able to cross the blood-brain barrier. That matters because it can directly influence the central nervous system. The simplest way to think about it is this. Your brain has a system that can turn activity up and systems that turn activity down. Imagine a gas pedal, a brake pedal. Glutamate is one of the brain's signaling excitatory chemicals. It's as part of the gas pedal system. It helps with learning, activity and signaling, but excessive excitatory activity can feel like mental noise. GABA or GABA is one of the brain's key inhibitory chemicals. It's as part of the brake pedal system. It helps to calm things down. L-Theanine seems to influence this balance. The exact mechanisms are still being studied, but the broad idea is that it may help nudge the brain towards a calmer state without necessarily making you sleepy. That is why people often describe L-Theanine as supporting relaxed and alertness. And this is where brainwaves come in. Some studies have found that L-Theanine is associated with increased alpha brainwave activity. Alpha waves are commonly linked with a relaxed but awake state. Not deep sleep, not intense problem solving, more like a state you might experience when you are calm, present, and not overwhelmed. Now, let's translate that into real life. The goal for performance is not to be emotionless, is not to have no nerves. The goal is to be regulated enough that your skills remain available. That is a crucial distinction. Before a match, a presentation, or a high-pressure moment, a certain amount of activation is useful. You want energy, you want attention, you want readiness. The problems start when activation tips into chaos. That is when thoughts scatter, breathing gets shallow, muscles tighten, and you start interpreting the moment as the threat rather than the challenge. So, if L-Theanine helps some people move from amped and scattered towards calm and available, that could be useful. But remember the phrase, helps some people. Not everyone feels a clear effect. Some people feel calmer, some feel nothing. Some may feel a little sleepy. Individual responses matter. We do not treat this as a guaranteed solution. We treat it as a possible small lever. Let's talk about anxiety. This is where L-Theanine gets a lot of attention, and it is where we need to be especially careful with language. There is a difference between pre-performance nerves, pre-performance anxiety, and clinical anxiety. Normal nerves are part of being human. If you care about the outcome, your body will respond. Your heart rate may rise, your breathing may change, you may feel butterflies. That does not mean something is wrong. In fact, one of the most powerful shifts you can teach an athlete, client, or yourself is this. Adrenaline is not always danger. Sometimes it is readiness. The issue is when the nervous system becomes so activated that the person cannot access their preparation. They know what to do, but cannot do it. They have trained well all week, then tighten up before kickoff. They understand the presentation, then lose their thread in the room. They have prepared the podcast, then press record, and suddenly cannot find their natural voice. This is where regulation matters. Small human studies suggest L-Theanine may reduce subjective stress and dampen some physical stress responses in certain situations. In practical terms, that might mean a person feels slightly less overwhelmed, slightly less reactive, or slightly more able to stay with the task. But these effects are generally modest. We're not talking about removing anxiety. We're not talking about treating serious mental health. We're talking about replacing therapy, coaching, exposure work, medication, or proper medical care. We are talking about the possibility of taking the edge off for some people in some contexts. And that phrase matters, taking the edge off, because sometimes the goal is not to eliminate all discomfort. Sometimes the goal is to bring arousal down by 10 or 15%, just enough that that person can breathe, think, and perform. Here is a coaching example. Imagine a footballer who is excellent in training but becomes frantic before matches. They rush decisions, they miscontrol simple passes, they feel like the first mistake will define the whole game. If they ask about L-Theanine, the conversation should not start with dosage. It should start with the system. What happens in the 24 hours before the match? How much caffeine are they using? How did they sleep? What are they saying to themselves? Do they have a pre-match routine? Do they warm up in a way that settles them or winds them up? Do they interpret nerves as a sign they are not ready, or as a sign that the body is preparing? Only after those questions would you consider whether L-Theanine might be worth discussing with a medical professional. That is the coaching frame. Let's move from anxiety to focus. This is where L-Theanine becomes especially interesting because of its relationship with caffeine. Many people use caffeine to perform better. Coffee before work, coffee before training, coffee before a difficult task. Caffeine can improve alertness and attention, but it can also create problems. For some people, caffeine sharpens the mind. For others, it turns the mind into a browser with 37 tabs open and music playing from one of them, but nobody knows which one. Jitters, racing thoughts, irritability, a slightly anxious edge. And that's where L-Theanine may help. Tea naturally contains both caffeine and L-Theanine. Some studies suggest that the combination may support attention and mental performance better than either compound alone for certain tasks. practical idea is simple. Caffeine provides the alertness. L-Theanine may smooth some of the rough edges. For a person who enjoys caffeine but becomes overstimulated, adding L-Theanine may help them feel focused rather than frantic. Again, not for everyone. Not guaranteed, not a miracle. Potentially useful. Here's where this matters for high performers. Focus is not just a brain chemical issue. It's a behavior issue. If you take caffeine and L-Theanine, but your phone is next to you, notifications are on, you have not defined the task, and you're trying to answer messages while doing deep work, you do not have a supplement problem. You have a system problem. So if you're using L-Theanine for focus, pair it with focus hygiene. Here is a simple framework. First, define the target. Before a work block, write one sentence. At the end of this session, I will have completed. Not work on the project, completed. Second, remove the obvious distractions. Phone out of sight, notifications off, browser tabs closed, one task visible. Third, set a time container. Some people that is 25 minutes, for others it's 50 minutes. For deeper creative work it may be 75 to 90 minutes. Fourth, decide your caffeine strategy. If caffeine helps you, use the minimum effective dose. Do not keep adding more because you're tired from poor sleep. Fifth, if you're considering L-Theanine, speak with a medical practitioner first, test it carefully in a low-stakes setting, and track whether it actually helps. That is the vital part. Do not assume benefit because the label says focus. Measure your experience. Were you calmer? Did you stay on task longer? Was your thinking clearer? Did you feel sleepy? Did your sleep suffer later? Did you simply like the idea that you had taken something? The final question is not a criticism. The placebo effect is real. Expectations change experience. Rituals can be powerful, but if we are serious about performance, we want to know what is actually helping. Let's talk about sleep. This is where supplement marketing often gets very loud. Sleep is emotional because when you're not sleeping well, you become vulnerable to promises. If you're lying awake at 2:30 in the morning with a busy mind, almost anything that offers relief starts to look attractive. Some research suggests L-Theanine may help subjective sleep quality for some people, especially where stress or mental arousal is part of the problem. But we need to be precise. L-Theanine is not a sleeping pill. It is not a standalone treatment for insomnia. And if someone has chronic sleep problems, loud snoring, breathing interruptions, severe anxiety, depression, restless leg, persistent waking or daytime exhaustion, that needs proper medical assessment. Where L-Theanine might fit is the busy brain category. A person who goes to bed on time, but their minds keep rehearsing conversations, planning tomorrow, replaying mistakes, and solving imaginary problems. In that case, the primary target is not knock me out. The target is lowering pre-sleep arousal. But again, the foundations matter more. For busy brain sleepers, we think in layers. Layer 1, light. Get daylight early in the day if possible. Dim lights in the evening. Reduce bright screens late at night. Layer 2, caffeine. If you're having caffeine late in the day and wondering why your mind is still active at night, start there before reaching for another supplement. Layer 3, cognitive overloading. Write down tomorrow's priorities before bed. Write down unresolved worries. Get them out of your head and onto paper. Layer 4, routine. Same wake time where possible. A consistent wind down pattern. Not perfect, but repeatable. Layer 5, physiology. Breathing, relaxation, warmth, a calm environment, and giving your body a signal that the day is finished. Only after that would L-Theanine be considered as a possible additional tool, and only with appropriate medical advice. One of the traps in performance culture is trying to supplement our way out of a lifestyle that keeps creating the same problem. If your evenings are overstimulating, your caffeine is too late, your work never ends, your phone lives beside your pillow, and your stress has nowhere to go, L-Theanine may not be the main issue. The system is the issue. Now we need to talk about safety, and I want to repeat the warning clearly. This episode is educational. It's not medical advice. Before taking L-Theanine or any other supplement, speak to your doctor, GP, pharmacist, or another qualified practitioner, especially if you take medication or you have a health condition. In research and commercial supplements, common L-Theanine doses are often around 100 to 200 milligrams, with some studies using slightly higher amounts for particular short-term purposes. But dose is not just a number. Dose depends on the person, the context, other substances, health conditions, medications, and individual sensitivity. Some people may feel relaxed. Some people may feel sleepy. Some may notice nothing. Some may experience headache, digestive discomfort, or other unwanted effects. There are also important cautions. L-Theanine may have mild effects on blood pressure in some contexts, so anyone taking blood pressure medication or dealing with cardiovascular issues should be particularly careful and speak with a medical professional. Pregnant or breastfeeding individuals should not assume safety just because L-Theanine is found in tea. Supplemental doses are different and safety data may be limited. Anyone taking medication for anxiety, depression, sleep, blood pressure, neurological conditions should get medical guidance before adding supplements. And if someone is experiencing significant anxiety, panic attacks, depression, insomnia, or mental health distress, the answer is not self-treatment with capsules. The answer is proper support. There also is the long-term question. Short-term use at common doses appears to be well tolerated by many healthy adults. That is not the same as saying daily use for years is definitely risk-free. We often know less than the marketing implies. So my philosophy is use the smallest useful intervention. Use it for a clear reason. Track the result. Do not use supplements to avoid solving the actual problem. And when in doubt, bring in a medical professional. This is not being cautious for the sake of it. This is being intelligent. Let's make this actionable. If a listener is curious about L-Theanine and they have spoken with a medical professional, how should they think about testing it responsibly? Here is a simple self-experimentation framework. I call it the CLEAR approach. C. Clarify the problem. Do not start with the supplement, start with the target. Are you trying to reduce pre-event nerves? Are you trying to smooth caffeine jitters? Are you trying to improve deep work focus? Are you trying to calm a busy mind before sleep? One supplement cannot be judged properly if you do not know what problem you're asking it to solve. L. Log your baseline. Before changing anything, track 3 to 5 days of your normal pattern. Rate your anxiety, focus, sleep quality, caffeine intake, training load, and stress. You do not need a complex spreadsheet. A simple 1 to 10 score is enough. For example, morning energy, 1 to 10. Focus during your main work block, 1 to 10. Pre-event anxiety, 1 to 10. Sleep quality, 1 to 10. Caffeine amount and timing. Notes on stress, training, and recovery. Why baseline first? Because if you do not know where you're starting, you cannot tell whether anything helped. E. Experiment in low-stakes conditions. Never try a new supplement for the first time before a match, race, presentation, exam, interview, or major recording. Test it on a normal day first. If someone is going to use it before a performance, they should test it in training conditions long before using it in competition conditions. This is basic performance hygiene. You do not wear brand new boots for the cup final. You do not change your nutrition strategy on race day. And you do not introduce a new supplement in a high pressure moment just because the internet said it might help. The next one is A. Assess the effect. After trying it, ask, did I feel calmer? Did I feel clearer? Did I feel sleepy? Did it affect my digestion? Did it change my heart rate or sense of physical tension? Did it improve the task I actually cared about? Did I sleep better or worse or the same? Would I have noticed the difference if I had not known I had taken it? The last question keeps us honest. R. Retain, revise, or remove. If it clearly helps and a medical practitioner agrees it is appropriate, it may be a useful tool. If the effect is unclear, stop giving it credit. If there are side effects, stop and seek advice. If you find yourself needing it psychologically before every performance, pause and look deeper, because confidence should not become dependent on a capsule. The supplement can be part of the system. It should not be the system. Let's apply this to 3 common scenarios. Use case 1, pre-event nerves. This is the athlete, performer, or professional who gets overactivated before a big moment. They're not clinically unwell, they're not in crisis, they are simply more wired than is useful. The first move is not L-Theanine. The first move is pre-performance routine. That might include a consistent warm-up, 2 or 3 minutes of slow breathing, a short cue phrase, a clear first action, a reframe from I am anxious to my body is preparing. If, after medical advice, they test L-Theanine, it should be treated as a small addition to that routine, not the centerpiece. Use case 2, caffeine sensitive focus. This is the person who likes the alertness of caffeine but dislikes the jitters. They drink coffee and become productive for 20 minutes, then scattered for 2 hours. For this person, the first question is caffeine dose and timing. Could they reduce the coffee? Could they switch to tea? Could they avoid coffee after midday? Could they pair caffeine with food? Could they improve sleep so they're not using caffeine as a rescue drug? If they still want to explore L-Theanine with medical guidance, the aim should be smoother focus, not artificial stimulation. But they must still build the work system, one task, clear outcome, distraction-free block, recovery break. Use case 3, busy brain evenings. This is the person physically and mentally switched on. The day ends, but the mind does not. Again, the first tool is not a capsule. It is shut-down routine. Try this. 10 minutes before the evening wind down, write 3 lists. List 1, what I completed today. List 2, what needs attention tomorrow. List 3, what am I allowed to stop thinking about tonight? Then, dim the lights, reduce the stimulation, keep the phone away from the bed, and give the body a repeatable signal that the day is done. If L-Theanine is considered, it belongs inside that routine, not instead of it. That phrase is worth remembering. Inside the routine, not instead of it. Let's just be clear. There are times when L-Theanine is not the right answer. Do not use L-Theanine as a way to ignore burnout. If your life is overloaded, your recovery is poor, your work boundaries are non-existent, and your body is constantly telling you it is under strain, the answer is not to keep adding calming supplements so that you can tolerate an unhealthy setup. Do not use it to avoid mental skills training. If you struggle under pressure, you may need to practice pressure. You may need exposure. You may need reframing. You may need routines. You may need to build trust in your preparation. Do not use it to self-treat significant anxiety. If anxiety is interfering with daily life, relationships, sleep, work, or well-being, speak to a qualified professional. Do not use it to replace medical care. Do not change prescribed medication because a supplement seems to help. Do not mix supplements with medication casually. Do not assume natural means safe to you. And coaches, this is important. Stay inside your scope. You can educate, you can ask good questions, you can encourage clients to speak to medical professionals, you can help them track habits, routines, and performances, but you're not there to prescribe supplements. One of the most powerful things a coach can say is, this is a medical question. Let's bring your GP, pharmacist, healthcare provider into that decision. In the meantime, we can work on the foundations we know matter. That is not weakness, that is professionalism. How do you talk about L-Theanine with your clients or coachees? If you're a coach, trainer, mentor, or manager, and someone asks you, should I take L-Theanine? Here is the language you can borrow. You might say, L-Theanine is an amino acid found in tea. Small studies suggest it may help someone or some people feel slightly calmer or more focused, especially in stressful situations or when combined with caffeine. But the evidence is still developing. Effects are usually modest, and it's not a treatment for anxiety, insomnia, or a medical condition. Then you can add, before taking it, speak with your doctor, GP, pharmacist, or another qualified medical practitioner, especially if you take medication or have a health condition. If they say it is appropriate, test it carefully in low-stakes conditions and track whether it actually helps. That answer does three things. It respects the science without overselling it, it keeps you inside your scope, and it brings the conversation back to intelligent action. You could then ask, what are you hoping it will help with? The question is powerful because sometimes the client says, I just want to feel less anxious before competition. Now you can work on pre-performance routines. Sometimes they say, I cannot focus. Now you can look at sleep, caffeine, phone habits, and task design. And sometimes they say, I cannot switch off at night. Now you can look at evening routine, stress management, cognitive overloading. The supplement question often opens the door to deeper coaching questions or conversations. That is where the real work is. Let's bring this together into clear takeaways. Takeaway 1. L-Theanine may support calm focus for some people, but the effects are usually modest. Do not expect transformation. Think nudge, not overhaul. Takeaway 2. The best use case may be situational. Prevent nerves, caffeine jitters, deep work, or busy brain evenings are more realistic targets than expecting L-Theanine to fix chronic anxiety or serious sleep problems. Takeaway 3. The foundations come first. Sleep, recovery, caffeine timing, breath control, preparation, attention training, environmental design, and emotional regulation are the main system. L-Theanine, if used at all, is a small add-on. Takeaway 4. Test, do not guess. Track your baseline. Try changes in low-stakes conditions. Monitor effects. Keep what helps. Drop what doesn't. Takeaway 5. Medical guidance matters. Before taking any supplement, speak with your doctor, GP, pharmacist, or qualified medical practitioner. That is especially important if you are taking medication, have blood pressure concerns, are pregnant or breastfeeding, or have anxiety, sleep, or mental health symptoms. Takeaway 6. Do not build confidence on capsules. If you start believing that you cannot perform without a supplement, step back. The deeper goal is self-regulation, preparation, and trust. The edge is not dependence. The edge is intelligent ownership. So what do we know? L-Theanine is not magic, but it's not necessarily nonsense either. The current evidence suggests it may help some people feel a little calmer, a little bit more focused, and possibly a little less affected by stress, particularly in the context of caffeine use or situational pressure. But the word little matters. This is not a replacement for therapy. It's not a replacement for medical care. It is not a replacement for sleep. It's not a replacement for preparation. It is not a replacement for learning how to regulate your nervous system under pressure. The real winning edge is not chasing every new supplement that appears in your feed. The real winning edge is understanding yourself well enough to know what actually moves the needle. Knowing when a tool is useful, when it is unnecessary, and when it is becoming a distraction from the work that matters. If you take one idea from this episode, make it this. Supplements can nudge, but your systems and habits do the heavy lifting. Before we finish, one final reminder. This episode is for educational and informational purposes only. It is not advice. Before taking L-Theanine or any supplement, consult your doctor, GP, pharmacist, or qualified medical practitioner, especially if you're taking medication, have a medical condition, are pregnant or breastfeeding, or are dealing with anxiety, sleep problems, or mental health concerns. If this episode has helped you to think more clearly about anxiety, focus, and performance, share it with someone who is trying to stay calm under pressure. If you haven't done so already, follow the Winning Edge Coach podcast. And what would be really helpful is to leave a review or a rating. It helps more people find practical, science-informed strategies for performing and living better. Once again, thank you for listening. This is the Winning Edge Coach podcast. And remember, the edge is not the pill. The edge is the system you build around yourself.